Great, thank you. Thank you everyone for joining. I first want to start by acknowledging the importance of observing that today is Juneteenth, commemorating the emancipation of enslaved Black Americans. At Public Health Seattle and King County, we recognize racism as a public health crisis. And this is a day to reinvigorate our commitment to recognizing and dismantling institutional and structural racism, including its adverse health impacts that are so evident during our response to the COVID-19 pandemic. We hope our actions on both fronts will help reduce the disproportionate health impacts from COVID-19 and a broad range of other health conditions for our communities of color. Now I'll speak about phase 2, which we were approved for today, phase 2 of the Governor's Safe Start Plan. And as you may know, the main differences are relatively small between where we were at 1.5 and 2. The restaurants can now open at 50% of capacity with tables of 5 people or less. Retailers will also be allowed to have 30% of normal occupancy limit, up from the current limit of 15%. And you can participate in limited outdoor recreation with up to 5 people outside of your household. Those are the main additions to where we were. So not a huge jump, but we think it's important to move forward for many reasons. And as you know, we have metrics that we evaluate when we apply to move forward for phase 2 and for additional phases. We evaluate a number of factors and look at a big picture when we decide whether or not to move forward, not any one in particular. And it's critical, of course, that our healthcare system, which is probably the single most important factor, is currently well prepared to care for COVID-19 cases, as well as the other health needs of our community. If there is a single most important factor, that is it. However, we also have increasing testing capacity, and we're meeting our goal of reaching cases within 24 hours of assigning them to our investigators, and we're continuing to expand our case and contact investigation capacity. And as you know, our cases here in King County have declined significantly since the peak of the outbreak in late March. At the time we made our application, cases were hovering around the target goal of less than 25 cases per 100,000 residents over a 2-week period. However, we want to share with you that over the past 7 days, we've seen an uptick in the number of cases compared to the previous week, and this is concerning. Between June 12th and June 18th, we experienced 113 more cases compared to the previous 7 days. That represents a 47% increase. And these cases are from all areas of the county. The largest increases are in young adults and in Seattle residents. We have not seen an increase in hospitalizations or COVID-19 related deaths. We believe this increase is likely due to increasing activity as we get back to business, work, and recreational activities in the community. We haven't found a single venue or risk factor identified as the cause of the increase. I want to remind everyone that we expect to see an increase in the number of cases as we increase our activities in the community. With increased activity comes increased risk, and we need to be very cognizant of that, and we need to do everything we can to manage that risk safely if we're going to continue to reopen. So we will be continuing to track the level of disease, hospitalizations, and deaths very closely over the next few weeks. And we'll watch the trends. And if these increases continue, we'll need to think about whether or not we need to step back. Nobody wants to do that. We need to remember how important it is that we move forward safely and that we all have a responsibility to take precautions to make sure we can do that. So I want to speak a little bit about prevention. As you know, and as I've mentioned, as we come together more and we have more activity, it's more important to protect ourselves because the risk increases. So it's vital that people remember this is not a time to let down our guard, that we must continue to maintain physical distance of 6 feet from others and minimize contact with people outside the home to the extent that we can. We need to remember the importance of wearing cloth face coverings in public when we can't have physical distancing, and to avoid group gatherings in poorly ventilated spaces. Hand washing, hand sanitation with sanitizers remains very important. And of course, anyone who develops symptoms of COVID-19 should call a healthcare provider and get tested as soon as possible, even if those symptoms are mild. We have more widely available testing now, and the sooner we get tested and can isolate ourselves, the better we'll be able to prevent the spread of COVID-19. So taking these steps of self-isolation, testing as quickly as possible minimizes the risk to others. We have free open access testing sites available now in King County, and there's a list of these locations on our Public Health COVID-19 testing page website. And we want to make sure that our high-risk community members, adults over 60 and people with underlying health conditions, remember that they're still in a high-risk group for severe illness. COVID-19 has not gone away. We need to continue to take precautions, those of us in high-risk groups, and be very careful to avoid unnecessary risk, unnecessary close contact with others, and try and stay home as much as possible. I know that's very difficult, but as I said, we remain incredibly susceptible to this virus, and it has not gone anywhere. So in closing, I'd just like to remind everyone in the community that we're dependent on one another if we're able to move forward safely and continue our activity. It's essential that we maintain our separation of 6 feet, use cloths, face coverings when in public, when distancing is not possible, wash and sanitize our hands frequently, and stay home when ill. At this point, I think I'll pause and be happy to take questions.
Great. Thanks so much, Dr. Duchin. So we have several questions with folks raising their hands. Let's start with South Seattle Emerald. Just a moment, you can go ahead with your question. Just one moment. You can go ahead.
Okay, great. Thank you. So I did want to ask, given the fact that fewer and fewer people are wearing face masks, as noted by many folks, not just those in the media, and that the fact that the number of cases has gone up in the past week, why did you greenlight King County applying to move to phase 2 instead of taking a beat and waiting, say, a week or so to see what would happen following a lot of outside activity given the weather, particularly given that outside or areas around the country that have opened up quickly are seeing dramatic spikes in infections and deaths?
So are you asking about why we went to phase 1.5 or went to phase 2 from 1.5?
Went to phase 2 so quickly from 1.5 rather than taking, I mean, it hasn't even been a month, I don't think.
That's correct. Yeah, it's been about 2 weeks since we went to 1.5, and our numbers are very stable, and the jump from 1.5 to 2 is relatively small. And we felt that we understood that there's risk and uncertainty anytime we go forward with increasing our activities and the need to try and open up our economy. So that was a risk that we took, and we understood cases might increase as we get back to business. That's been assumed and understood from the beginning. So we felt that it was a reasonable risk at that point, and we would love to be able to continue to move forward, but we do need to manage the risk as we go forward by taking precautions. I think there's a misimpression in the community that because we're moving forward, the risk is lower and that we can relax a little bit. But in fact, it's just the opposite. As we begin to do more and we begin to have more activities, we've always known that the risk will be increased and we may see more cases, that we'll be likely to see more cases, and we're going to need to double down on our efforts to prevent the spread of COVID transmission so we can continue to move forward to the greatest extent possible so we can get people back to work and our economy running. and at the same time not be overwhelmed with large numbers of cases and hospitalizations.
Great, thank you. Hannah from Crosscut, I believe. Go ahead.
Hi, thank you so much for doing this. I wanted to ask about the pilot test for contact tracing, which was one of the problem points in the phase 2 application. I recognize that the pilot test was implemented on June 9th, and I was wondering how that test was going and if any of those 3 proposed possible solutions are looking promising.
So thanks, Anna, for your question. The pilot is going well. We're learning a lot, and we're enhancing our staff so that we can do more case and contact investigations and improve the timeliness of that work, and also better understand the needs of the community who are isolating or quarantining themselves, so we can support folks. I'm not quite sure about the 3 options that you're referring to.
There were a few suggested avenues within the application of ways that the county might address the contact tracing delays.
Well, okay, so we haven't come to any conclusions yet about the best way to go forward. We're looking at a variety of different methods. Clearly, we have to have a lot of personal touch in this work, establishing a relationship with the cases or the contacts. And we want to have community support as well from community health workers and social service agencies when necessary. And we're also looking at the potential to use text messaging as a way to track people over time, monitor them while they're in isolation or quarantine, and determine what their needs are. But at this point, we don't have any findings or conclusions from that work. That will take a little bit longer.
Thank you. Gabriel Spitzer, go ahead.
Hello, thank you very much. Well, 2 things really. One is you had mentioned that it doesn't seem like there's any specific venue or activity that is driving the increase, that it's pretty widespread. Have you been able to get a handle on what, if any, increase is attributable to the public protests and demonstrations? And then secondly, how specific can you be about what criteria would cause the county to potentially step back to modified phase 1 or phase 1?
Yeah, thanks for that question. So we have been monitoring the exposures to the extent that we can characterize them in the community for our cases. And we haven't found, basically the exposures which are primarily, the number 1 exposure are our household exposures. Someone reports someone else in their home was ill with COVID, or contact with someone else with COVID. Essential workers and long-term care facility medical personnel. And then there's a wide variety of other, places that everybody goes that don't rise up to be very common for, the group. With respect to the large gatherings, we do ask everyone if they've attended a large gathering or a rally, and we've not found much. For example, out of all the hundreds of cases, that we see each week, in the last week, we identified only 6 people who identified as having attended a rally or protest event. And in the week prior, we only identified 8. So it doesn't appear to be a major driver of what's happening in the community. It may be, anywhere and any time people come together, there's opportunities for transmission. And nothing is jumping out at us right now as one driver that's more significant than another. We see cases clustering in workplaces. We know that people are out and about for social reasons. We see people in restaurants and doing lots of things in close proximity, closer than we would like based on the 6-foot rule, that present opportunities for transmission. And we've also had lots of reports of people not wearing face masks, and that's another measure that if enough of us do, will be also extremely helpful in limiting transmission. But we don't have right now, a single smoking gun that we could point to say if we could just stop this, the risk factor, our COVID problem would be significantly less. There's risk everywhere people come together, and there's not one thing. And the rallies really, we don't have evidence that the rallies or the protests are being associated with large numbers of cases currently.
Thanks. Ryan Blethen from Seattle Times. Go ahead.
Yeah, hi. Thanks for taking the question, Dr. Duchin. So with this 47% increase in cases this last week, when did public health start to notice that uptick, and why didn't that play a factor in applying for phase 2 if we saw that the numbers were starting to grow so dramatically?
Yeah, actually, it was about 10 p.m. last night when our epidemiologists were analyzing the newly arrived lab data that this trend became apparent, and that's why we're sharing it with you today. So we had applied for our phase 2 on Monday, and by Thursday night, we had seen a trend here that we think is noteworthy and important to share with the community, because at the time we applied, we were very flat, and right now we're seeing a little bit of an uptick. And so we really want to get the word out at the time, as soon as we detect this, that we need to be more careful about COVID prevention across the community. And someone had asked earlier, what would be, an indicator that we may need to do things differently, reconsider where we're at with the phases, et cetera. And that, it's really about trends, both the temporal trends with respect to increases, because things do go up and down. And I'd be very happy if this is a blip that returns down, but it's the biggest blip we've seen in a while. And that's why we want to make sure people know that this may be an indication that we need to be more careful as we move forward. But if this trend continues to increase, that would be something that we would have to take very seriously, both looking at the number of cases and the rate of increase. And those are the two most important factors with respect to case counting. And then, of course, looking at our illness, hospitalization, and emergency department utilization, because in the younger people, we see more cases, but they're less severe cases. So it's possible that with the increasing number of cases, as more younger people are doing things that are bringing them in close contact with COVID-19, they are getting infected, are driving up the case numbers a bit, but that might not have a substantial or very large impact on the healthcare system, because most of those people recover without needing hospitalization. However, if we start to see more cases spreading into the vulnerable populations that end up in the hospital, and our hospital beds filling up, that will be a very serious red flag for us that we need to do something different.
Thank you. Let's see, Graham Johnson, Cairo Radio. I'm sorry, Cairo? Looks like, Graham, you may have dropped off. Let's go to, feel free to jump back in. There you are, Graham, go ahead.
Hi, Sharon. Thanks so much, Dr. Duchin. So just to follow up on Ryan's question there, now that you have this data from last night, do you regret that we are now in phase 2?
Thanks for the question. No, I don't think we need to step back from phase 2 at this point. As I said, everyone understands that as we go forward, the risk increases and we expected to see additional cases. We don't know where the trend is heading, but we want to alert the public that this is a time to get serious about COVID-19 prevention. Because if we want, as a community, to continue to get back to business and the activities that we all so want to get back to, we need to be careful and continue to take those important prevention steps like physical distancing, mask use whenever in public, and distancing isn't possible. And continue to remember about meticulous hand washing, not going out when ill, and isolating at home when symptoms, or if and when symptoms develop. So no, I don't regret that. I mean, our community really needs to get back to work. We need to get our economy going, and people really need to get out of their homes and try and resume some of those activities that are important to them. And there's a balance we need to strike between how much we can do and how safely we can do it. And so I don't want to be at a point where I regret, or any of us, none of us want to be at a point where we regret that we've opened up the community too much and we're seeing too much result in serious illness. And that's one of the reasons we're talking to you today, because I think that it's possible that some people feel like the risk has lessened and that they don't need to take precautions the way they did initially. And it's just the opposite. The risk is still there. We're still susceptible. We're doing more. And if we want to continue doing more and stay healthy, we need to continue to take precautions every day, everywhere we go.
And if I could just follow up, just so I understand why the word uptick is being used to describe a 47% increase, which sounds like more than an uptick to me. Is that simply because it's only 1 week and we don't know if it's a sustained trend?
No, I mean, uptick means an increase, and a percentage, is one thing, but look at the absolute number as well. We're talking about over a whole week, 113 more cases. So we're not talking about thousands of cases here, and this could come down again, next week if things go well. So it's an increase. Uptick is just a synonym for increase. But the 47%, if we started with 2 cases and we went to, 4 cases, that would be a 100% increase. So it's not just the percentage, but the absolute number of cases here, and also the impact on the healthcare system that we look at.
Great. And now we'll have a question from Ryan Harris from Como Radio. Go ahead, Ryan.
Sorry about that. I had to figure out how to unmute there. Thanks for that. Can you hear me now?
We sure can. Go right
Okay,
ahead.
thanks. So sorry. So Dr. Duchin, I just wanted to follow up on the question about the protest being a factor. I know you're seeing positive cases from other areas, but just because you're not seeing a great number, I just want to make sure I'm clear that that doesn't necessarily mean that we won't see more cases coming out of the protest, because doesn't it hinge on those people actually getting tested as well and getting those test results?
Yeah, thanks for your question. Our ability to understand where transmission occurs absolutely depends on people getting tested, and we encourage people, please, if you've got symptoms, seek testing quickly, stay home, don't be around others until you have a test result, especially if you've been in contact with someone that you think may have COVID. So yes, you're absolutely right. It depends on people coming forth and being tested. So regardless of where you're exposed to COVID, if you have mild illness, you may not come forth and get tested, but you can still spread that disease to someone else who can develop a serious illness, which is why it's a good idea to get tested, even if you have a mild illness. It's true that there may be cases that are undetected. That's undeniable, and that's true in every setting, at large gatherings, at restaurants, at workplaces, anywhere where transmission can occur. Some cases come to our attention and some don't. It's estimated that, overall, nationally, including locally, we detect, 10 to 15% of the cases that are actually occurring. So there's a lot of undetected transmission that happens in the community. And as you may remember, the vast majority of COVID cases are asymptomatic and mild. So we tend to become more aware of the serious infections. And that's one of the challenges with a disease like this that can spread from people who don't have symptoms and then cause severe illness in others. So it's not possible to know every case. And although we try to have people, aware of the importance of staying home even with mild symptoms, it's challenging.
Thank
Great.
you. And as we'll go next to Paige Browning from KUOW. Just as a reminder, you can raise your hand if you want to ask a question for media. Go ahead, Paige.
Hi there. Thanks for taking our questions, Doctor. I have a bigger picture question quickly. If you had a crystal ball about how long we will be under some sort of restriction, how long it's going to be until we reach phase 4 or even beyond that, based on your best knowledge and estimates, I'm just wondering how long you think we will be under some restrictions. It may help people to mentally prepare for the long haul if you think this is going to be a very long time.
Thanks for your question, Paige. I think that COVID is going to be with us for a very long time, for years. But I think that its impact will be lessened with time. Certainly, if a vaccine becomes available, which is not going to happen in the very near future, that's months away, maybe many months away, maybe years away. More therapies will undoubtedly be developed that will allow people to be treated, even if they develop serious illnesses, which will be a good thing. But this disease is not going to disappear. So yes, we will be needing to grapple with it, and I think it will fundamentally require us to reconfigure our lives in many ways, in the way we interact with one another, with respect to distance from one another, in the way our physical and workplace environment is structured to allow more space, more telecommuting, decreased gatherings in workplaces and other venues where people come together, barriers between people, the use of masks. These are going to have to be long-term changes if people want to stay healthy and keep our community healthy and economically viable. Because if we don't take those preventive measures over the long term, the disease will rebound. And as I said, it isn't going anywhere. It's waiting for us to let our guard down, and then it's going to come back. And so we must think of this as a long-term issue that is requiring us to fundamentally change the way we interact with one another and the way we go about our business in the world. And if we're lucky, a year from now, we'll think differently, and the risk will be significantly reduced, that we can start to get back to the way we were pre-COVID. But I don't see that happening in the near future.
Thank you. And I think we'll take one last question. Go ahead, CE Bick.
Hi, yes, I did want to also follow up to ask, just because I didn't get a chance to. You did mention that you do keep talking about higher risk pools and such like that. When we talk about the disease, I mean, it's been shown that young people can get quite seriously sick too. For instance, rather recently, a young woman who was not obese or overweight and didn't have any underlying health conditions had to have a double lung transplant. And I remember this so vividly because her lungs looked like broiled cheese and meat. And so what would you say to an otherwise healthy young person who isn't wearing a mask, one of many I'm going to repeat because of what I've been seeing and what I've been hearing from others, who doesn't believe that they're at risk for a serious case?
Yes, thank you for your question. There's two important points that you're making. One is that although young people are at much lower risk for serious health problems from COVID-19, they are not absolutely without risk, and that some young people have very serious illnesses. And the other important point that you're making is that even though younger healthy people are at lower risk, they are still as able as anyone to spread this disease to others and to people who are at higher risk. And the only way that we're going to be able to move forward safely as a community and do the things we want to do and be healthy is if we all understand how codependent we are on one another. What I do protects you, what you do protects me in every context, at the workplace, when we're at businesses, retail, bakeries, coffee shops, construction sites, recreation, gyms, hair salons, barbershops. Every one of those places is interdependent. The precautions that we take in all those environments affect how successfully we're going to be in each of those environments. We're all very interconnected when it comes to COVID safety. And we really need our young people and everyone to understand that and to be team players and do everything that they can do everything that we can all do by taking the precautions around avoiding unnecessary contacts, keeping physical distance, wearing masks whenever in public, to keep each other and our community safe and healthy over this marathon that we are facing.
Thank you, and I appreciate everybody being on the call and asking such poignant questions. We really appreciate the coverage and making sure that we get this information out to the public. Dr. Duchin, is there anything else you wanted to add before we wrap up?
Thanks, Sharon, and thanks to all the media for joining today. I just do appreciate your getting the word out. We need to be able to keep the importance of COVID-19 risk and COVID-19 prevention front and center in the mind of the public, because this is a long haul. This risk is not going away. As we do the things we need to do and the things we want to do and get more active in the community, our risk will be increasing and our need to take prevention steps will be increasing at the same time. And that's the only thing that's going to allow us to go forward together and stay healthy as a community. So thank you for getting that message out. We're going to need to continue to repeat that message regularly and for a very long time. We appreciate your help with that.
Great. Thank you all again for joining us. And with that, we'll go ahead and wrap up.